And this morning I want to talk to you about eczema. And this will be Podiatry Tips Day 202. And I'm going to do eczema by answering those four questions. Number one, what is eczema? Well, truthfully, eczema, another word for eczema is atopic dermatitis. It is a condition that makes the skin red and itchy. It can include multiple symptoms, including dry skin, itching, which may be severe and a lot of times is worse at night. It can be red to brownish gray patches. It's common on the hands and the feet, ankles, wrists, neck, upper chest, eyelids. It can have small, round, raised bumps. It can be scaly, cracked skin, or it can be just a really raw and sensitive areas as well. And the idea is it's more common in children, but it can happen at any age, and it doesn't really have a treatment, doesn't really have things that can completely resolve it. And so there are things that can actually make it worse. And oftentimes there are things that you can actually do for yourself. But why does it happen? Like I said, we don't exactly know exactly what the causes are. But it seems to be a moisture problem, whether your skin is not getting the moisture in it. It has certain things that actually make it worse. Number three, what can you do for it at home? Moisturize the skin multiple times a day, usually at least twice. Find any triggers. If you're saying, okay, I always get my eczema when this happens, you can do shorter baths or showers that can actually help. Using different soaps or gentler soaps, all that kind of stuff can reduce it as well. When should you see the doctor? Truthfully, if it gets uncomfortable enough that it's interfering with life, especially if it's interfering with sleep, especially if you get to the point where you saying, okay, I'm starting to get red streaks, pus, or the scabs are starting to get yellow, all indicating that you could have an infection. Or if the symptoms continue to get worse, even with all the home treatments, all the things that you're trying to do to treat it. So eczema can be pretty problematic. It can progress to a pretty severe infection if you're not careful, because you're constantly scratching it, and you can irritate it in such a way that it can get pretty bad. So if you have eczema and if it's getting worse and you're not able to treat it at home, it is a good idea to talk about getting additional treatments by going and seeing the doctor. This is Dr. Brandt Gibson. Have a great rest of your night or rest of your day, depending on what part of the world you're in at this time.